Hi, I'm Luke Bongiorno, Director of Physical Therapy at New York Sports Med, with some advice on some of the best and most effective ways to treat ankle sprains. An ankle sprain is one of the most common and painful sports-related injuries. The main causes are poor motor control, loose or overexerted ligaments, or when too much pressure is applied to the ankle as it overcompensates for underlying problems at the hip or the knee. Symptoms include pain with weight bearing or when pressure is applied, accompanied by swelling and bruising. It's important to remember the word RICE. That's rest, ice, compression, and elevation. And it should be done for 48 to 72 hours immediately following the injury. Once the pain and swelling have subsided, it's important that you begin a physical therapy regimen. A return to full function and mobility requires targeted conditioning of the ankle joint in conjunction with exercises that help strengthen the core, the hips, the glutes, and the hamstrings. Rehabilitation also needs to be continued at home on a daily basis. Gentle calf stretching, balancing exercises, and taping will help provide stability and support to help aid in a quicker recovery. It's recommended that you continue the program for at least 6 weeks. As no two injuries are alike, it's important that you meet with your healthcare provider when considering the best course of action to take.